So good afternoon, everyone, and thank you for joining us today. I'm Adelisa Perez-Hudgens, Director of Quality at the New Jersey Healthcare Quality Institute. The Quality Institute is a multi-stakeholder membership organization that convenes healthcare leaders in New Jersey around the common goal of improving the safety, quality, and affordability of healthcare for everyone. I just have a couple of housekeeping items before we get started with today's presentations. Please know that the webinar is being recorded and a copy will be posted to our website at www.njhcqi.org later today. All phone lines will be muted for the duration of this presentation to limit background noise. However, you will be able to ask questions at the end of each speaker's presentation. You can either type into the chat box, or you can also raise your hand, at which point we will then unmute you and you'll be able to ask your question live. The raise hand button is at the bottom of your screen. So again, thank you for joining us today for our fourth installment in our Stronger Together, Improving the Safety, Quality, and Affordability of Healthcare for Everyone webinar series. Today's presentation is entitled Best Practices for Quality Improvement and Healthcare Providers' Mental Health Support During COVID-19. All of our previous webinars can be found under the resource pages at our website. Again, that's www.njhcqi.org. Today, our speakers will discuss maintaining quality improvement during COVID-19 and updates to the 2021 Leapfrog Hospital and ASC survey, as well as experiences and outcomes delivering behavioral health services to staff during the pandemic. So for our first speaker, we're honored to have Leah Binder, President and CEO of the Leapfrog Group, as our keynote speaker. Since 2008, Leah has served as President and CEO of the Leapfrog Group, a national nonprofit based in Washington, D.C., representing employers and other purchasers of healthcare calling for improved safety and quality in health systems. Under Leah's leadership, Leapfrog added to its hospital ratings the ratings of hospital outpatient departments and ambulatory surgery centers, as well as launched the hospital safety grade, which assigns letter grades on safety of general hospitals across the country. And so without further interruptions or further hesitations, I introduce Leah.
Thank you. Thank you. It's great to be here. It's great to be virtually in New Jersey, one of my favorite states, and also one of my favorite states for healthcare. I think New Jersey has led the country in many, many ways on safety and quality. So I'm proud to have worked with all of you, and I'm really proud and excited to be here today. I was reflecting a bit this new year on parenthood, just thinking about how many people gave me advice when I had my first child. And the one piece of advice that I remember the most was the statement, "You don't know what worry is till you have a baby." And I thought, wow, that never have I heard anything truer. At the time when I heard it, I was pregnant. I thought, oh, come on, I'm not going to be like that. But the minute my baby was born, worry moved into our house. It became not just a verb, worry, to worry, but actually a noun, a thing in our house. You try to hide it from the kids, of course, but worry, worry, worry. And I don't think it's ever going to go away. My son is 22 now, and that worry still lives with us every single day. And when I think about hospitals during the pandemic, I think of hospitals now as institutions that worry about us. And just like parenthood, it's a 24/7 job. You don't really get a day off because worry is always there. When you run a hospital, you work at a hospital, you're a frontline worker at a hospital, but even if you work at a hospital in housekeeping, or you are the CEO, any level, any position in a hospital, you worry about your community, you worry about us. And we charge you with that. And sometimes that takes more courage than we know, and sometimes more exhaustion than we know. All of us are tired of this pandemic. I'm tired of it. But I'm counting on my hospitals to worry about me and my family every day and not get so tired of it that they can't come to our rescue should we need them. So that was the reason this year Leapfrog wanted to honor those who had come to our rescue so many times in 2020. We had our annual meeting back in December, and we had many dozens of nominations for a Pandemic Heroes Award that we've given out. There are a number of pandemic heroes that are listed on our website. I just wanted to point out two who won our highest nomination, which was the Englewood Health team in Englewood, New Jersey. And on an individual level, Sergio Alvarez, a nurse at Coral Gables Hospital in Miami, Florida. Both of these organizations had an extraordinary influence on us at Leapfrog, just hearing the stories of what they did and what they endured. Sergio really worked 24 hours. He did worry about his patients every single day and night. He gave patient families his cell phone number, and he called them. If he didn't get to talk to them that day, he called them that night. He was on the phone with families all the time because he said, families can't be here, so I have to be the family. So that was truly extraordinary service. And I think for so many of you probably on the call today who work in a hospital, for my co-speaker, Dawn, I'm sure you all experienced, and you're all doing this now, that this is the kind of everyday heroism that you are going through. This is the everyday worry that you are experiencing and that you are on our behalf giving to your community. So I really am appreciative, and we are at Leapfrog very appreciative of this, and we do honor you for this real service to our country in this time of great need. So Leapfrog is a nonprofit, and we publicly rate hospitals and health systems and ambulatory surgery centers on behalf of our constituency, which are employers and other purchasers of health benefits who are concerned about the quality and safety of care. We're independent, and members of industry, so to speak, folks who do business in the healthcare industry, as well as hospitals and healthcare systems, are not part of our governance structure. We rely on them in an advisory capacity in a variety of ways, and that is extraordinarily important to us. But in our governance structure, we are totally independent. So we have tried to be helpful during the pandemic in any way we can. We want to be helpful, but at the same time, we want to continue to convey the message that patient safety should be the #1 priority in healthcare, because without that, nothing else works for the patient. The patient is at catastrophic risk. And we all know that, but sometimes it's very easy to overlook safety. But in a time of pandemic, more than ever, the basic fundamentals of patient safety have come to the fore as so critical. And hospitals, like so many in New Jersey, really, that have a culture of safety and have been working every single day for the past 20 years to get safety right, that had to have paid off during the pandemic, because all of a sudden there was no room for error at all. All of a sudden, the entire country was looking at you, and it didn't matter only for our healthcare, which is important enough, but for our economy and our way of life. All of that suddenly was on your shoulders in your ability to do the very fundamental tasks that are necessary 24/7 at every hospital in this country. So we try to offer some public resources to the public on how they can wash their hands. Here's an example, as well as to hospitals themselves on reminders on quality and safety. And we also made a lot of changes to our survey last year. You may recall our survey launched as it always does, April 1st. That was really at the height of the pandemic in the United States. Certainly in New Jersey, that was a time of surge and terrible, just terrible death rate at that time. So it was very important for us that we could be as helpful as possible without, as I said, conveying the message that somehow safety is less important. It's just as important, if not more important right now. But still, we recognize that hospitals are not able to complete all of the survey-related work that's necessary to give the public and to give Leapfrog the information that we need to understand the safety and quality and to drive a market for improvement nationally and in New Jersey. So we did a number of the changes. One was that we allowed hospitals to maintain their 2019 survey results in lieu of reporting on the new 2020 survey. They could just leave their 2019 results up. That certainly helped a number of hospitals where the capacity was simply not there to do the survey at all. Hopefully, however, and for the most part, most hospitals did choose to do the 2020 survey. We extended the submission deadline by a couple of months to August. We made a lot of reductions in survey submission requirements, and we extended reporting periods for things like the culture of safety survey. It's a very important survey. As I mentioned, it's important that hospitals do have a culture of safety to be prepared for this pandemic or the next pandemic. Having a culture of safety really lifts a hospital into the position that they need to be in, which is not easy to get to cross all T's and dot all I's in the delivery of care 24/7. So it's really important to have a finger on the pulse of your culture of safety. But we did allow hospitals to up to 36 months between surveys this year only, for 2020 only. We changed some of the public reporting on hand hygiene. We have a new standard on hand hygiene. And while we are not, we believe hand hygiene is critically important, and it's long past time that that hospitals became the very center, the very best at hand hygiene of any place in the country. Hospitals should be the best at it. It's time for that to happen. So we wanted that to continue, but we did start reporting only the top 2 performance categories for hand hygiene in order to give hospitals a little bit of relief on that upgraded policy. And then we suspended our on-site data verification, where we go into hospitals, selected hospitals, to verify their survey results. And we did a intensive series of one-on-one assistance hospitals with assistance calls from our help desk. So we took a number of dramatic steps. For us, this was dramatic, and I think for many hospitals, from what we heard, this was very helpful. So while all this was going on with hospitals, and we're recognizing the importance of hospitals in our community, the fact that we count on them to worry about us so much. Meanwhile, of course, in the economy, we have employers in 2020, and they had quite a year as well, as you all know. Employers worried about many changes, whether it's making sure their workplaces were safe and that their workers felt safe going back to work. And unfortunately, they had to worry as well about layoffs, furloughs, and problems in the economy, and complete changes and shifts in the economy. So changes from, for example, for retail or for the travel industry, complete and utter overhaul of the travel industry. Overhaul, probably a nice word for it, but just a complete loss of business in many sectors of the travel industry. Just massive shifts and rapid changes in how resources are deployed and used, and where revenues are coming in and where they're going out throughout the economy. So big change for employers. And of course, sadly, especially for small business, a time when either businesses are suspended entirely and workers are furloughed, or worse of all, of course, is when many businesses closed and people were permanently laid off. And of course, we know that that's had a very significant impact and continues to have one in all of our communities. So rough change for employers throughout our communities. But at the same time, what the employers that Leapfrog has been working with have also seen some encouraging change, for them encouraging. Now, perhaps not all of you will agree that this is encouraging from your perspective, but I will say from the perspective of employers who have worried for a very long time about healthcare quality, about the actual value of care that their employees are getting, and about their costs, this has been a year of some encouragement. For many years, employers have pushed, in Washington especially, but I know throughout many states, and I'm sure in New Jersey, have pushed for price transparency, and that's happening. There is actually, as of January, as you all know, there is a requirement from CMS that hospitals post their prices, not just their CMS prices, but their prices that they're charging for commonly selected procedures. So that's a breakthrough that has been extremely important to purchasers and employers. Telehealth, as you all know, telehealth burst onto the scene in March and April and May as CMS released many restrictions and allowed it to be reimbursed at really the same rate as an in-person visit. Just something, again, that purchasers throughout all of the purchaser advocates that I work with in Washington have been extremely excited about and have been encouraging their plans to make it easier for them to reimburse for this as well, to foster this movement, to change really how healthcare is delivered so that telehealth becomes much more routine in the care of every individual patient. A big, very encouraging change from the perspective of employers. And then finally, the surprise billing issue has been a major priority concern for many purchasers and employers. It has been a top agenda item for the largest companies who are part of the ERISA industry committee that we work with many times. That is their number one policy agenda on healthcare, was the surprise billing problem. And part of the reason that employers are concerned about that is because when there is a surprise bill, when there's somebody's billed some extremely large amount for something they didn't anticipate having to pay for through an emergency visit or something, sometimes the employer steps forward and pays the bill. In fact, quite frequently they will do that. If there is a major bill, I talk to employers all the time. They're like, oh yeah, we get this complaint all the time and we're paying tens of thousands of dollars because we can't have our employee shouldering a $20,000 bill from an anesthesiologist, for instance, in an in-network hospital. They just won't let that happen. So they are actually financially paying for this in addition to just the issue they have with the injustice they feel when people really think they're going to a hospital that's covered. Everything should be covered. So there was content in the relief law that was passed and signed by President Trump, and it is not exactly perfectly what purchasers wanted, but it's close. And at least we have seen real progress finally on this issue that is of great frustration to employers. So on the policy level, right now, very encouraging changes that employers want to see only accelerate in the future. And perhaps the biggest change that I think, and I have to call it astounding because it's had a big impact on employers, so that you're all aware. I think hospitals should be aware of this. Now, I know all hospitals are aware that their revenues are down, particularly around elective surgeries. It's been a major problem, I know, for hospitals. And many hospitals are themselves furloughing or even laying off workers, closing centers, closing ambulatory surgery centers. There's just been a real issue in health systems throughout the country. So we're aware that this has been a extremely painful time financially for hospitals, in addition to all that they've shouldered on our behalf for the pandemic as frontline responders. However, I will say this, that through all that, employers have noticed that their health costs are down very substantially. Now, the numbers are not all in. This is one estimate that was done by PwC, but what I'm hearing is that costs are down below last year's costs per employee for many large employers. And, employers have complained about health costs forever. I'm sure you've all heard it. You can't talk to an employer who won't complain about health costs and how they grow, and they're driving them crazy, and it's a big issue. And their CFO every year is yelling at the HR director, why can't we get the health costs down? That's a big issue. It's a big issue for employers. But nonetheless, this is the first time I've ever heard where health costs go down. That has really gotten their attention. More than health costs going up, which they're used to at this point, even if it is frustrating. They went down, and all of a sudden the CFOs are on the phone, and now it's of interest on the C-suite. I've never seen employers more energized by this fact of health costs going down than I've ever seen them with health costs going up. So that has put this issue of value in healthcare on the radar at the top levels of the largest companies. And it's something that you will start to see the impact of next year. What it means is that value, that quality and safety, and that is what we mean by value, that those things now are top priorities for employers. They are full speed ahead on safety and quality. This is not the time for hospitals to think, well, it's a pandemic, so let's hold off on that. From the perspective of employers, that is unacceptable. We have to go full speed ahead. First, because they now recognize how important it is to have hospitals available to them. You worry about us. And second, because they've suddenly realized what can happen with health costs. It's just put it on their board of directors agenda. So they want to see, they want reassurance that patients come first, that safety remains your critical priority, and that we will work together to make healthcare more affordable, recognizing just how hard it is to keep safety and patients at the center of a time of great national emergency. They recognize that. They still have high expectations. So that means it's full speed ahead for Leapfrog. We have now a panel of employer benefit innovators, and they have reinforced the point I just made to you. My C-suite says move, move, move. So we have joined forces with Health Transformation Alliance, with the Business Group on Health, and with others to push forward on quality and safety, because that is the first priority. They recognize that that has to be better to get where we need to be in terms of a better healthcare system. We have looked at a methodology change for the hospital safety grade this year, which is not going to affect hospitals, or not affect in a major way hospitals that currently report to Leapfrog, but it is a change because the American Hospital Association has declined to provide Leapfrog with data that we used to license. So we are now changing the methodology for the hospitals that don't report to us. There's a slight change, but it's a significant one for them. And we're now launching a campaign around diagnostic excellence. We're making that announcement tomorrow, so you're getting a little early preview of it. We have received a grant from the Moore Foundation to do a project to identify what are the triggers for diagnostic errors and what are the best practices for addressing them. We're bringing together the foremost experts in this topic and researchers, along with purchasers and consumers, to try to understand that and to develop a survey that we can pilot for hospitals, as well as some tools, resources, and efforts by a group called the Society for the Improvement of Diagnosis in Medicine, SITM, which is also a group of providers, leaders in healthcare who can come to work with hospitals to see if these practices work and what's the best way to do it. So we'll be, in other words, helping hospitals to improve to reduce the harm to patients from diagnostic error. We recognize that every diagnostic errors will happen because diagnoses are made by human beings. Humans make errors, but we want to make sure that we have systems in place, the Swiss cheese effect, so that those errors do not result in terrible harm to the patient. And that's what we're going to help with. And we're ultimately going to hold systems accountable for achieving the highest in diagnostic excellence. So that project launches this year. And then we're going to be closing loopholes in transparency and putting a priority on patient safety throughout our advocacy work. We've worked with AARP on some efforts to publicly report infection rates, not just by hospital, which we have somewhat right now, but also by nursing home, by dialysis center, by ambulatory surgery center, et cetera. The CDC is capable of doing that, and it's time we had that. The public is looking for that, and we've recognized that through the pandemic, how important it is. We're also going to work with health plans to make sure that they are assisting in this move toward improvements, quality, value, that the accountability is driven up. That's been a big priority from the C-suite. So for next year, for the survey, we will be, we are currently reviewing whether there will be any major COVID-related changes. Right now, only one change from 2020 is planned for sure, and that is to allow that 36-month interval between culture of safety surveys. but there may be additional changes. We've reviewed some of the options with some of you, some hospitals, and our experts. We are reviewing them. We are going to see how the pandemic is evolving before we make a final decision, but there's likely to be some reduction in the requirements for participation in the survey. But in all cases, the 2021 survey will be required. We're not going to do what we did last year, which was to say you could keep your old survey from 2019, you could keep that and that would be enough. That will not be acceptable this year. However, again, we are likely to make some changes depending on the resurgence of the pandemic. We will likely make some changes to make it somewhat easier to participate. And we're adding 2 components. They're not scored, but they're new and they're important, and we want hospitals to pay attention because we are likely to build on these in coming years. We are asking some questions about health equity and whether hospitals are stratifying their quality results around race, ethnicity, and language. So we begin to understand, at least we have to understand how we're doing for people who are often not getting the level of healthcare that they should. So we want to make sure that hospitals are aware of those issues and can address them. And then we're also going to look at financial ethics. So those issues around surprise billing and some of the other issues that that employers have been concerned about. They want their employees treated with dignity and respect, which we know is a priority for hospitals, but we also want it to be a priority on every level of the patient experience, and financial experience is part of that equation. So we're asking a few questions about that as well. We'll welcome feedback on those questions throughout the year. This is, as I said, a fact-finding year. We're learning about these 2 issues and how we can ask hospitals and apply best practices across the country, but look for those. And then we will require the 2021 survey to be eligible for our top hospital awards and some of our other awards. We now have we're working with Newsweek on a maternity hospital, best maternity hospital campaign that we started last year. It's continuing this year. So some other kinds of awards that we do will require the 2021 survey to be submitted. And then another thing I'll update you on for next year is we're working with Steve Burrows. He did a film, which I encourage you all to see. It's a documentary on HBO called Bleed Out. He's a guy who works in Hollywood. He's actually a comedian. He produces films. And his mother got very sick and through a medical error in a hospital and a series of errors that then subsequently followed. Over a period of 10 years, you actually see the evolution of this situation, and he shows you on film what happened. It is a very powerful film. It won a number of awards. So we're working with Steve Burrows to look at, well, how can we do more to prevent this kind of thing from happening? How can we address some of the issues that Steve saw in his experience that's in this film? We're not in the film at Leapfrog, by the way, but that doesn't matter. What matters is his mother and him. They are in the film. And all of the ways that what's in our survey and our work around safety and quality would have helped. But how do we make that even more impactful? How do we make sure that the next Steve Burrows knows about this and knows about your efforts as a hospital when you are achieving this excellence, that he knows who you are? And so that's why we're going to form the Judy Burrows Education Institute. It's coming in May. We're now raising money for it. We want to educate. We want to offer educational tools for hospitals. Leapfrog will not provide them. We will work with others who will provide them, who are experts like you are in quality improvement and safety improvement, but we will facilitate that to happen. And we will work with employers to educate them about the important issues around quality, and we'll work with consumers to educate them about how to look for quality, what is important, and how to really be an advocate for your loved one when they are in a hospital. So we're trying to educate all the stakeholders so that everyone can come together effectively to make a difference and prevent the next Judy Burrows from the experience that is so troubling in their family. So the quality of, as Vince Lombardi said, the quality of a person's life is in direct proportion to their commitment to excellence, regardless of their chosen field of endeavor. So whether you're an employer or whether you are working in a hospital like Sergio and giving so much of yourself and worrying about all of us, either wherever you are, excellence should be our common mantra. That should be what we're both about. We need to work together. We need to hold each other accountable for that. And we need to move forward into 2021, and let's hope a much better year and a much better horizon for all of us than last year was. So thank you. And I believe if there's time, I'm open for questions.
Yep, we definitely have time for questions. Thank you, Leah, for that wonderful presentation. And it's always helpful to hear what you're hearing from both patients and employers on their priorities and what's important to them. It helps, those in the medical healthcare arena prioritize their own focus for the upcoming year. I think at this time, you can ask Leah questions by typing into the chat box, or if you'd like us to unmute your line, please feel free to raise your hands by clicking, again, the raise hand button at the bottom of your screen. But while we're waiting for the audience to submit their questions, I thought I would ask one or two that we have gotten in the last couple of months from a few folks. One of them was definitely about whether or not you're making adjustments to this year's survey, so I appreciate you addressing that. I think another question that we've gotten a lot too is about the submission periods. Last year was the initial submission period was extended from June to August due to the pandemic. Do you anticipate making that change? I know you're not finalizing them yet, but is that something that you're considering for this year, or will June 30th be the first period?
We are considering moving beyond June 30th, but it will not be as late as August. So if we do it, it will be probably in July.
Okay. And then do you anticipate that changing the deadline to submit your survey for inclusion in the safety grade calculation has always been, the end of August deadline? Do you anticipate that being pushed back at all?
No, the end of August deadline for the snapshot date for the safety grade will remain August 31st.
Thank you for that. And you did mention your partnership with the Health Transformation Alliance. Can you provide any more details a little bit about how you'll be working with them, or what projects you anticipate coming up?
Yeah, well, for one thing, they are going to serve as what we call a national rollout for Leapfrog. They are going to work with us to encourage participation by hospitals and by ambulatory surgery centers in our surveys, because they are very interested in using the data that comes from those surveys to inform their own members, who are all very large employers. I think they have like 50 very large employer members right now. So on the one hand, they're going to work with Leapfrog to encourage participation and to really drive this improvement in safety and quality. We're also going to work with them to look at claims data next to Leapfrog data to try and come up with ways of analyzing that data in powerful ways to really recognize safety. As you all know, safety is not always apparent from claims. Claims don't really always get at some of the key issues with safety. So a hospital can be doing very well on safety, and that isn't necessarily going to come out on their claims data. So we want to make sure that it does, because it does have a real impact on both quality and cost for their patients. So what we want to do is be able to come up with ways to analyze that data and give reports and information to the employers, which in turn can be used to change how the market rewards excellence. So stay tuned on that, but we are working with their data analysts and ours coming together to see what we can do with that.
Thanks. We're definitely looking forward to the reports that we anticipate you'll be putting out this year, if not next. I don't see any questions yet, so I'm going to keep going because we got a couple from hospitals prior to the webinar and definitely during the pandemic. But, with hand washing is always definitely a hot topic, and as particularly with the increased hospital traffic and the shifting priorities through the pandemic, has Leapfrog thought about adjusting that 200 per month direct observation requirements for this year, or will they kind of be maintaining that requirement?
The plan is to maintain the requirement, which we did last year too, by the way. But what we did last year was didn't report hospitals for being at a lower performance standard. So if they couldn't reach that and they couldn't reach other parts of the hand hygiene standard, which has more than just the monitoring standard incorporated into it, if they couldn't meet all of it, we didn't necessarily report them for that. And that was not incorporated into the safety grade. So we're considering that, depending again on how, on the pressures that we see hospitals under with the pandemic currently. But we're not going to change that standard. We believe that hospitals, as I said earlier, should be the #1 place that you would go if you want to know how to wash your hands right. I mean, frankly, that should be the best place in the world for hand hygiene. We should just think, oh, they do hand hygiene perfectly at a hospital. That should just be, I mean, we've known about hand hygiene for what, 200 years, maybe 150 years. I think Florence Nightingale talked about hand hygiene. We know this is important and it's time we took it seriously. And so, you know, the World Health Organization and other authorities have looked at best practices for how you get there. It's not easy. Recognize it's not easy. And one of the most important ways is really careful monitoring. The hospitals that have undertaken this level of monitoring, whether it's the 200 observations or having electronic monitoring systems, have found that their estimates earlier on their compliance with hand hygiene were not correct. That in fact, their level of compliance was far lower than they thought. So it's really important for hospitals to make that level of commitment, and the pandemic is the first place. It's the most important time. This is not something we can skimp on right now. So we strongly encourage hospitals to take another look at their hand hygiene regimen and to be the best there is at it.
Well, thank you for your time today, Leah, and for answering our questions. Again, if anyone did have questions that they wanted to ask Leah that they didn't have an opportunity to, or just didn't think of them on the spot, definitely feel free to reach out to us directly, and we'll be sure to get those answered for you. And so with that,
thank you.
No, thank you. With that, our next speaker is Donald Parker. He's president and CEO of the Hackensack Meridian Health Carrier Clinic, the largest nonprofit behavioral health system in New Jersey, and president of Hackensack Meridian Health Behavioral Health Care Transformation Services Integrative Medicine. Carrier Clinic operates an acute care mental health hospital, a residential treatment center for adolescents, a fully accredited special needs school for students grades 7 through 12, and the Blake Recovery Center, an inpatient unit focused on addiction recovery. And with that, Donald, you can feel free to take it over.
Thank you, Adeliza. First of all, I want to thank Leah for warming up the crowd for me about worrying, because my subject matter is going to be what happens when you worry too much. So let's go to page 2, Dappa. I got an assistant to help me work my way through the slides. So I want to read you this and pay attention to the words. So breathing labored, shallow breaks the cadence of quiet sleep. Fever and pain punch different clocks. Fluids stream in weathered arms to kill the parasite invading. I look over my domain of 88 beds, always filled, and I wonder about a lot of things. Night and darkness always do that. So that is written by a nurse in 1969 in a Vietnam field hospital. Vietnam gave birth to the diagnosis of post-traumatic stress disorder. And post-traumatic stress disorder is the order of the day in behavioral health impact of the crisis that we're in. So let's keep rolling on the slides next. So I won't bore you with details on this, but you can see all the different things that we're worrying about, whether we ourselves can become patients with COVID, are changing every day new ways to do our business. Leah, we have been through 100 different procedures for everything that we do. Nothing is on autopilot today. We cannot assume anything that we do will be what we're doing tomorrow in healthcare. So the days of being able to go into work and go through things that you've been trained to do don't exist. Next slide. So these are some of the things that I've heard our staff at Hackensack Meridian talk about. So especially I wouldn't be able to live with myself if someone I love got sick because of me. Next slide. So these are the things that describe stress and the effect of stress, PTSD. So PTSD, by the way, didn't become a DSM diagnosis until 1980. So it took a lot of work, and actually the work came out of the Department of Veteran Affairs because they saw so many PTS constellations of behavior that they actually lobbied the DSM to include it as a particular diagnosis. So I re-experience things just pop into my mind out of nowhere. I avoid things, I block out, I try not to think about things. Alterations in my mood, I'm feeling scared, angry, guilty, or ashamed almost all the time. And increased arousal rate. I'm afraid something's bad going to happen. I jump at loud noises, I can't concentrate, and I can't sleep. Sometimes it's not unusual to have all of these different diagnoses simultaneously. Next slide. So these are your emotional responses, and I can't run into anybody that I work with, used to play with, I interact with, I do business with, that doesn't come up to me and say, hey, Don, you're in behavioral health. Do you think these are problematic if I'm feeling them all the time? Whether it's chronic exhaustion, whether it's new physical ailments, almost universally sleep issues. I'm feeling guilty all the time. I'm feeling apathetic. I'm feeling bored. I'm feeling anxious. I'm feeling irritable. I mean, you go down the line, by the way, and these are all symptoms that patients don't just experience one, they experience many of these characteristics. Next. So in the health system, I'm responsible for all the behavioral health, and we are not on the front line as much as our colleagues who are in the hospitals dealing with COVID cases day to day. We do get COVID patients within our psychiatric inpatient units, and we manage them. We generally manage them in concert with our colleagues. But we felt that we needed to step up into the front line to help our colleagues, to use the skills that we've developed in our careers to assist them through this really intense behavioral challenge of dealing with COVID. So you can see our skills and activities are all built around self-help. We use CBT, cognitive behavioral therapy. We've customized care. We reduced barriers. Interestingly enough, we found an inflection in the destigmatization of behavioral health because so many people are experiencing it. And so we've been working with One Mind at Work, a national organization that works on destigmatization, on strategies and campaigns within the organization to reduce the stigma even further, so that those who need it and those who will be needing it can get it without the fear of being stigmatized for that. And then looking at strengths of all of our clinical staff. Our staff are here to help. That's why they got into business, and we take advantage of the fact that they're here to help and have them help one another. So next page. So we created an infrastructure. We appointed a chief wellness officer, one of our, actually the medical director of our hospice program, and who else had more heart than Amy Friedman, who picked up that job. We brought in an new employee assistance program. We started a We Care program. Now, this is manned voluntarily by our psychologists and social workers throughout our system, 24 hours a day, the entirety of the pandemic, who are available to talk individually with their colleagues. It's done anonymously, and we have calls every day from somebody who's getting to the brink of what they would feel to be a breakdown. And it's our job to get them back focused again on how they can self-help. If we don't feel like they can self-help, to get them to a professional that can intervene for them. And then I personally find, and have been engaged in, coping with COVID talks. So at the end of each shift for our COVID units, we go out on the floor and then sit with our colleagues and help them decompress and help them go through what they felt while they were on the floor. And I think that immediate intervention for our staff has been incredibly beneficial to their ability to recover, to go to the next shift that they have to serve inside of our hospitals. And that's also brought a great deal of enlightenment to our colleagues who have been doing that volunteer work, who in turn go out and train the rest of our staff, both how to cope with those on a pre-work basis, and then what to do when you get home. So next slide. So we've engaged, I'm in charge of integrative medicine across the whole system. And integrative medicine is exactly what it sounds like. It's to be integrated, and it's integrating things that maybe not, things that would not be normally done inside of a hospital, whether it's essential oils, or it's breathing, or it is stress reduction in a variety of different ways. So we have regular activities, as you can see at the bottom, mindful meditation 7 days a week. We have 5 live sessions that goes out on our internet that you can engage in wherever you are. You can take a break. All of our lounges have TVs in them, and we broadcast that across all of our lounges. So you can go and sit in a lounge with a group of your colleagues and meditate. We have self-care series where we focus on different components of how you can care for yourself at home and care for your loved ones who are probably going through the same experience, and sharing your anxiety on a daily basis to help them manage you and manage their own lives. We have nutrition counseling constantly. What do we do when we get stressed? We eat bad food that exacerbates our stress. It's a very important thing for us to be able to make available to our staff. Next slide. These post-shift stress debriefings, our neuropsychologists, again, if we notice that there's an exceptional level of stress building in a unit, we bring in our neuropsychologists who also work with the individuals who are doing those post-stress debriefings that I mentioned before, but it takes it up a notch. For all of our leaders, we found that the leadership system oftentimes avoids getting help. You're a leader, you're not supposed to need help. But our leaders are working for us. I think the average amount of time off last year for our leadership team was 3 days. And so when you're working 6-7 days a week and you're not taking any time off, it builds up. Again, you can't be on any autopilot. Those are the times, by the way, during the day when we recover, when we're doing things that benefit us. So we have added a whole series. In fact, we just launched a new EAP service directly for our senior and executives and our physicians that will be reaching out to them in very personal ways to assist them. We've designed our health benefits to eliminate copays, contributions for any behavioral health service. So we pick up the tab for that if you need it, to make sure that there's no barriers for getting care. Next slide. We have expanded our behavioral health panels to make sure that we get individuals that are trained in managing post-traumatic stress disorder, as well as the kinds of stresses that our patients, or excuse me, our staff experience, so that we have almost double the size of our panels. We are now going through and teaching mental health first aid to every one of our leaders. What we don't want our staff to do, if in fact they have a performance issue and it's a result of a mental health stress or challenge, that we don't address that issue, that we don't move to discipline or removal because of something that's a result of a mental health issue that they've suffered inside of the hospital as a part of their work. I've already mentioned One Mind at Work. Next slide. So we've also rolled out a whole variety of new resources for our patients. We have a behavioral health urgent care center, the first one in the country, that we opened a year ago, which has been extremely busy. You can drop in, no appointments required. You see a psychiatrist. It's private. We do it in an existing urgent care center, so there's no stigma to walking in the door. And it's open 7 days a week. And that has been very heartily used by our staff and our patients. We're in the process of locating additional areas where we're going to expand that business. We do telepsychiatry visits. Leah mentioned the transfer to telepsychiatry. We did 92% of our 2,000 outpatient visits went to telepsychiatry. Prior to the pandemic, we had 6% of them, and we're struggling along year by year to expand that. So that inflection allowed us to reach more patients more effectively and more efficiently, we believe, than if we were doing face-to-face. And then we have a variety of new technologies that we are engaged in using. So we're creating our own Apple store for behavioral health. That will be, by the way, part of our new behavioral health urgent care center. When you go there, we'll post-diagnosis, we actually are already doing, introducing you to new ways of handling your psychiatric issues. So it's hypothalamic stimulation for substance abuse. Your hypothalamus shrinks during substance abuse. We stim it with low voltage alternating current back into full action in a short series of treatments. Acoustical stimulation we use, if you're highly anxious, we use acoustical stimulation coming out of a chair that is focused on chakras, through headphones that's focused on your vagus nerve. Combination of it calms you down very quickly. We use it at our hospital for patients who are aggressive. We have an electronic acupuncture assisted detox program. No medication required. Actually wear a couple of units right behind your ears for several days, and it will take you through detox with minimal pain. And then we use voice recognition software. The software is set up to analyze the anxiety in your voice, as well as any other symptoms that are subject to diagnosis through this voice recognition software. It assists our clinicians in more accurately diagnosing you. Next page. And then here's some additional resources for you. Some of the things that we've picked up are listed here. Please feel free to tap them. There's no secrets in any of these, but there's lots of great idea. I would highly recommend the mental health and psychological first aid. It is a great, it's just like learning first aid, except it's for mental health. And we now have gone beyond doing our own leaders and are doing leaders throughout the communities. We're now specializing in doing police leaders, educational leaders, and community leaders so that they can recognize and get people assistance when they need to and have this. That's a truncated version of this presentation, but hopefully you got some good ideas and you feel encouraged to go forward with new approaches.
Thank you, Don, for that great presentation. Again, great strategies that you shared and some interesting new technologies. Definitely looking forward to hearing about the impact of some of those in the coming months or later in the year once you've really implemented them a little bit more.
Yeah, I do a lecture on from Radio Shack to the Apple Store in behavioral health. So book me.
You know, I have no doubt that would be an interesting presentation. So definitely something that I know I'll consider, if not for Quality Institute itself, but our Mayor's Wellness Campaign. Those are interesting to hear about. At this time, you may ask Donald questions by typing into the chat box, or again, if you'd like to be unmuted, just please raise your hand and we will unmute your line. But in the meantime, I thought I have a couple questions of my own based on both what information you gave us and some questions that we've heard from folks over the last couple of months. You did mention the We Care program and the Coping with COVID talks, even the mindful meditation. You know, a lot of questions that I've heard is these strategies that you're implementing for team members, are they occurring during working hours, or is it something that they really participate in kind of outside of those hours?
Almost everything is available both. While you're at work, as you saw, we have our own TV network within the system. We broadcast out a lot of the meditation sessions, the dietary adjustments, nutrition, etc. Those all go out on our TV system internally. You can also access a whole library of tapes of these, just like we can access your lectures at home if you want. So it's your choice. We give time for our staff to make sure they do this. The stress debriefing is on our time at the end of a shift. We believe that's a great investment of a little bit extra time where we pay you to be able to get some ideas about how to cope with what you've just experienced. I think if people have the opportunity when right in immediate after they've experienced a very stressful day or shift or patient, that they get the chance to talk to somebody about it and deal with it rather than going home and sleeping on it and having that add to what's called a stress pileup.
And you mentioned broadcasting it on all of your on all the TVs. Are there other methods that you have found that are helpful? How are staff members really learning about these? Are leaders talking about them? Or is it emails? How are you getting the message across?
We do regular training sessions for both leaders and our staff, as well as we have about 25 staff that we deploy through our hospital systems who are in the units, who are specialists in integrative medicine. We have acupuncturists, we've got health coaches, we've got individuals who are doing Tai Chi, Qigong, and a whole variety of different techniques. We give classes in all of our hospitals, make sure that classes are both during and after work.
That's great. And I don't see any, so I'm going to slip in one more before we run out of time. We've really been hearing from a lot of providers that they're reluctant to receive mental health care or participate in some of the things that you've mentioned, just because they're concerned about, being reported, their license, or whether they're going to be perceived a certain way, either by their peers or their direct supervisors. Any words of advice for them, or how can they be reassured that, this seeking help and taking up, especially for those organizations that are offering it to their employees, that it won't affect kind of their work or their license?
Yeah, I really think it's important for leadership to show vulnerability. And, as I mentioned before, leaders are experiencing similar kinds of issues as our staff are. At one of our sessions, a large training session last week, I was invited to speak, and I started out with my own story of what's happened to me during the pandemic. And by doing that, I talked about the stress in my family, how it manifests itself. And I think that more leaders need to do that. When we show that we're human, when we show that we're vulnerable, it makes a difference to the people that surround us and whether they're willing to talk or not. So that's a real leadership responsibility, is to demonstrate our own vulnerabilities.
That's a great point. And I think it holds true just in talking about behavioral health, but also when talking about quality improvement, that it kind of is coming from the top down and from the bottom up. It works both ways. So thank you again. If anyone has questions that they couldn't think of at the moment or didn't have an opportunity to ask, feel free to share those with us and we'll make sure we get them over to Don. But thank you both for your wonderful contributions to our conference. At the Quality Institute, we believe that collaboration is essential to improving our healthcare system. That's why it's so critical to have all of you, our dedicated members, engaged and involved in our work. We greatly appreciate your time and commitment to improving healthcare for all and for attending today's session. We hope to see you at even more Quality Institute events, participating in our work groups, and engage in this important work over this next year. We did get a question about whether the copy of the slide deck will be available. Both the recording and the slide decks will be sent out to you within the next 24 hours, and they'll also be available on our website, both linked here. You can also go to njhcqi.org/resources. And if you could please take a moment to fill out our post-event survey that will be emailed to you, that would be greatly appreciated. Thank you again, and have a happy and healthy rest of the year.
Thank you very much, Adeliza.
Thank you. Take care.